Let me share something I'm seeing more and more nowadays. People are skipping the doctor and going straight to the pharmacy, the lab, alternative practitioners, or even Google to treat themselves. It feels efficient, it feels cheaper, it feels like you're taking control. But there's one important question most people don't ask. Do I actually know what I'm treating? Because in medicine, the most important step is not the treatment, it's the diagnosis. And diagnosis is not guessing. It's a process, a good medical history, a thorough physical examination, and appropriate tests put together by someone trained to do exactly that. Now let's talk about pharmacists. Pharmacists are the highly trained professionals. They are expert in medications, but their role is to dispense and advise on medicine, not to diagnose disease. So when someone walks into a pharmacy and asks, I have a cough, what should I take? Here's the real question. How do we know that cough is just a simple cough? What if it's a lung infection, tuberculosis, or something more serious like lung cancer? Without asking probing questions, without putting a stethoscope to your chest, without x-rays, no one can say for sure. Now, most pharmacists understand this very well, but sometimes, and this is where patients need to be aware, the line can become a bit blurred. When treatment is suggested without a confirmed diagnosis, even if well-intentioned, you as the patient must pause and ask, has my condition actually been diagnosed properly? Another common situation when instead of medicine, you're given supplements. Now, supplements have their own place, but when they are used as a substitute for proper diagnosis and treatment, that can delay care. And sometimes delay is the real danger. So again, not about blaming anyone, but as a patient, you need to recognize, am I treating or am I guessing? Now let's talk about Google and AI. These tools are powerful, but only as good as the question you ask. I saw a case. A man thought his wife had a miscarriage because she had bleeding early in pregnancy. He asked, what are the symptoms of miscarriage? Google's answer confirmed his assumption that a miscarriage in early pregnancy can present as menses that came late. But he asked the wrong question. If he had asked, what are the causes of bleeding in early pregnancy, he would realize there are many possibilities. Instead, he delayed seeing a doctor. 2 months later, sensing something wasn't right, the husband brought the wife to the doctor only to confirm that she was still pregnant. That's not a miracle. That's misinterpretation. Let me share another example. An elderly lady injured her ankle and went for massage and traditional treatment. Nothing wrong with that. These therapies can help with comfort and recovery. But after 2 months, the pain and swelling did not improve. At that point, something important should happen. A referral, a redirection, a reassessment. When symptoms don't improve, that's a signal. Something deeper may be going on. Eventually, she saw a doctor. It was not a simple injury. It was a fracture due to bone cancer. So again, this is not about blaming any practitioner, but as a patient, you should know any treatment that continues without improvement must trigger a proper medical evaluation. Another situation I see quite often, people go directly to labs for health screening. They get results, maybe low blood count, abnormal numbers, and then they ask, what should I take? Now, here's the key point. Lab tests give you data. They don't give you diagnosis. And sometimes in trying to be helpful, someone may suggest a solution based on that number alone. But without clinical context, without examination, that's incomplete. And incomplete understanding can lead to incomplete or even wrong treatment. So if you look at all these situations, pharmacy, supplements, AI, alternative therapy, lab tests, the pattern is the same. Treatment is happening without a confirmed diagnosis. And when that happens, you risk delay. And delay leads to more complications, more complex treatment, and often higher costs in the long run. I understand why people do this. Healthcare is not cheap. And people want quick fixes. People are just making practical decisions. But here's the truth. Skipping proper diagnosis does not save money. It only shifts the cost to later when the problem becomes bigger. So what should you do? I'm not asking you to distrust anyone or reject other healthcare roles. What I'm asking is for you to understand boundaries. Pharmacists are the expert in medication, labs expert in testing, therapists expert in specific treatments. But diagnosis is the role of the medical doctor. My advice is simple. Have a doctor you trust. Let them help you identify the real problem first. Because once the diagnosis is clear, everything else becomes clearer. The right medicine, the right therapy, the right outcome.